Hello, everybody. Welcome to our Natural Food Pantry Education Series. Joining me today is my guest, Dr. Hilary Chambers, for a conversation on iron deficiency. Dr. Hilary Chambers is a licensed and registered naturopathic doctor practicing in Toronto, where she is the founder of the Kingsway Wellness Centre. In her practice, she uses evidence-based natural therapies to treat the underlying cause of each patient's health concerns. Dr. Hilary is an avid writer and speaker and is passionate about teaching and inspiring people to achieve their health goals. Dr. Chambers recently joined Healthology as their Chief Medical Officer and Education Ambassador. Welcome, Dr. Hilary Chambers. It's so lovely to have you here with me for a conversation on iron.
Thank you so much for having me today. I'm really excited to be able to go in depth about iron with you today.
I know firsthand, I know from my own experience and from working with clients that iron deficiency, it can cause a lot of havoc in someone's life. It's a very common deficiency amongst women. Some children, some men and vegetarians can struggle with iron deficiency as well. I'm just wondering if you have any statistics on iron deficiency anemia in our society. How prevalent is it?
Absolutely. You're 100% right. I think even just speaking with women all day through what I do and with yourself, so many people have iron deficiency, but it's not just women. And so it's important to understand kind of the scope of where we might be seeing some iron deficiencies in people. So the stat is about 5% of Canadians, but that's the range of age 3 to 79. So we got to think to maybe kind of narrow that down a little bit. But 8% of women are deficient in iron. So that's deficient, meaning not even just not great, they're completely deficient. And of women, interestingly, the group that has the most likely deficiency are women aged 12 to 19. So that's something important maybe to take note of, that we don't often think about that. But ages 12 to 19, about 13% of those young women are deficient in iron.
That's pretty high. That's concerning. You know, I have a daughter in that age range and lots of her friends, so definitely something to consider.
Absolutely.
And why do you believe that iron deficiency is so prevalent in our society?
Well, I mean, it's tough to pick just one thing, so I'm going to have to give you a couple reasons. I mean, the first one that's maybe the most obvious for a lot of people is iron loss. So that's why it's more prevalent in women, is through menstruation. But anybody truly who's losing blood. So in patients, for example, who have Crohn's disease, where there might be some blood loss, for example, those are other ones to think of on that topic. So if we're losing iron, then of course we're more likely. But then the next one to think about is if you're not getting enough in the diet. Maybe this is why the young women aged 12 to 19, I know I did not eat maybe the healthiest when I was that age. But you know, if we're not eating a diet where we're getting enough iron, we're obviously not going to be able to build up those stores properly, and we're more likely to be deficient. So vegans and vegetarians are ones that come to mind specifically, but again, maybe other people who have nutrient restricted diets or have certain allergies or sensitivities where they're not eating a wide variety of foods or foods that contain iron. The third big category is people who have difficulty absorbing iron. This is the one I think a lot of people forget about, or maybe, overlook. So there's sometimes we don't absorb iron because people are taking medications that actually kind of block or compete with that iron from being absorbed. So the most common one are heartburn medications. So things that have calcium in them to try to neutralize your stomach acid if you're getting that reflux. That calcium will actually compete with iron and prevent that from being absorbed as well. But even if you're on other heartburn medications, those ones, even if they don't have the calcium component, they're still going to lower our ability to absorb lots of different nutrients, actually, not just iron. So something to be mindful of if you are taking medications is to look into that and see what that might be impacting. Again, iron for sure, because of how important it is, but with a wide range of all of our vitamins and nutrients and minerals.
Yeah, exactly. And can you talk to us about why iron is so important? Like what does it do in the body? What's its role in the body, and why is it important to keep our iron levels up?
I'm so glad that you asked that, because I think we all kind of know, yeah, you need iron, and if you don't have it, you might be anemic, right? But we kind of get to, if you go stop and say, wait, what is it actually, what is it for? How does it make energy? So here's the way I like to describe it to my patients. So iron's kind of like a little delivery truck, and it's going to pick up oxygen from our lungs. That's why we need oxygen, right? We all know we need air to breathe. But again, we stop and think and go, wait, why? So with the delivery truck, it's going to pick it up at the lung and carry it to every single cell in our body. It drops that oxygen off. And then all of our cells basically will use that oxygen, combine it with basically sugar, glucose from our food, and use that to make energy. But here's again where it starts to get, okay, yeah, Dr. Hilary, I know iron deficiency causes fatigue, but why are there other symptoms? What does energy really mean? And so I've started just calling it money. So basically, and nothing in life is free. So we need to be able to make money in order to do anything in the body. So me talking right now, moving, making hormones, growing hair, thinking, all of it costs money. And some things are really expensive. So the more iron, if we have enough iron, sort of sufficient iron, we can bring as much oxygen to our cells as they might need, so they can be as rich as they need to be in order to do whatever it wants to do in the body. So hopefully that sticks a little bit better than just the basic iron is energy type thing.
I love that analogy, the currency of iron.
Yeah, the currency of iron. That's what I should be naming these topics. That's brilliant.
That's great. And I think a lot of people, we're talking about symptoms, a lot of people probably mistake their symptoms of anemia for just generalized fatigue or stress or maybe hormonal changes. So can you talk to us a little bit about the common symptoms and maybe not so common symptoms of iron deficiency, when people should be getting tested, what is a normal range in terms of blood work?
Okay, so let's start with those symptoms then. So as we said, we need money for everything. So some things in the body are more costly. Some things in the body we're not going to sacrifice, right? We're always going to digest or think or move. But some things in the body start to kind of fall by the wayside. So those ones to look out for: a weak immune system. Really expensive to build an immune system, kind of like an army in real life, also expensive. I love when analogies work. But basically, so a weak immune system, if you get sick frequently, or if you have trouble recovering after illness, that might be something to think about. Hair loss in women. Unfortunately, I don't have the key for hair loss in men, but in women, if it's not hormonally related, it's often because we don't have enough iron to actually be growing that hair. Other things like depression and difficulty concentrating and thinking, difficulties with memory. Again, we often jump right over iron as sort of that basic need, and we jump into other things. So I always want to encourage to get that testing done if there's something that's not quite adding up or something that's changing in your body that iron deficiency could explain. And sort of on that note, actually, the one thing I really want to make sure that we spread the word about as much as we can is in children. Iron deficiency often presents as ADHD or behavioral challenges or cognitive developmental challenges. So we start to, again, leapfrog right over. I see a lot of kids who don't get blood work done. They are given diagnoses, which, yes, it's so important to be diagnosing children properly. But on the other hand, if they don't have enough iron to make that energy, money, where they can regulate emotions a little bit better, where they can focus and have that memory and concentration a little better and grow the way and develop the way that we should be, correcting that deficiency is the first step, in my opinion, of getting to the root cause and giving that child the support that they need.
Absolutely. So how do we correct that deficiency? Well, first, how can people prevent deficiency from occurring in the first place? And if they are deficient, what can they do to correct the deficiency?
Okay. So, I guess maybe we have to start by defining deficiency, right? Because this is something that, grinds my gears a little bit. But basically normal ferritin, so ferritin is what we test in the blood to see whether or not you have enough iron. These are storage amounts of iron. And normal is, in adults, 5 to 272.
That's a wide
But
range.
I know, it's a huge range. So you can imagine, right? Someone who's like at a 7 might not get a phone call back saying, yeah, your iron's low. We're starting to see it more and more. Um, but you can imagine that person's making money at a very different rate than the person who's at 150 for their ferritin levels. So we have to make sure that we're actually targeting where the research is saying it's not just deficient, but it's actually sufficient enough to have us be able to do all the things we need to do. So for adults, that number tends to be somewhere between 70 and 100 of a ferritin blood test. But of course, always check your reference ranges and check with your healthcare provider. But we need to be targeting that level. So now that we know if we do a blood test, we find that we're deficient or no, insufficient, what should we do? The first thing, of course, is change your diet. Absolutely. Yeah. So, I mean, I'm sure you know a lot of foods that might cause iron deficiency or sorry, that might be high in iron, so prevent iron deficiency. But of course, meats, chicken, fish are great sources. But what happens about vegans and vegetarians, right? Yeah. So in those groups, tofu and tempeh soy are great sources of iron. So is your beans lentils, your chickpeas, something like hummus might be something great that you can snack on. And then nuts and seeds. Pumpkin seeds and sesame seeds are my favorite ones for iron. So trying to be sprinkling those on every, bowl of oatmeal that you have, every salad, just try and be adding those in so that you get a little extra top up, especially if you don't eat a lot of animal products. It's really important. Mm-hmm.
Well, and I love that a lot of those plant-based foods that are high in iron also contain a lot of other healthy minerals. Pumpkin seeds are full of zinc and all these wonderful nutrients that work together in the body.
That's right. And what I love also is that a lot of the vegetable sources of iron, so spinach is one I didn't mention,
Right.
they also contain high amounts of vitamin C. And vitamin C actually kind of grabs onto iron and helps it get absorbed more readily, more easily. So it's an interesting thing that nature's done there, where we've boosted the vitamin C with some of those iron-containing vegetables so that it's going to ensure it gets into the body a little bit more effectively.
And what about supplementation? Would you recommend that people who are looking to correct iron deficiency or boost their iron levels take a supplement?
Absolutely. Sometimes a supplement is necessary for some patients. So of course you're making sure you do blood work and that it's recommended by your healthcare provider so that it's safe, because too much iron is not a good thing. But for those people who are taking supplements, I tend to suggest ones that are a liquid form, because you can adjust the dose, right? With different lab work, with even just person to person in the same household, you can adjust the dose easily. But the liquid makes it so much more well absorbed because your body doesn't have to break down a tablet or a capsule. It's just kind of there and readily usable. And then you want to make sure you're choosing a form of iron that isn't going to cause constipation or indigestion, digestive upset. We see that a lot. So one form that I really like is called ferrous gluconate. And this is a type of iron that, again, is really well absorbed and quite gentle on digestion. So you want to be making sure that you're making great choices so that you can take iron without side effects or issue, but it's going to effectively be raising those iron levels in the body so you can feel better.
I love that suggestion. And liquid would be so easy for kids to take as well. I know
Absolutely.
There's liquid supplements that taste really wonderful that you could add to your smoothie if you needed to. So really easy to take.
Yeah, it's an easy kind of, you're right, toss it in a smoothie, sneak it in there, your kid maybe doesn't even know. But even for adults, right, I think a lot of people don't love taking pills, so it's a nice alternative opportunity to have it as a liquid form.
Absolutely.
Mm-hmm.
Wonderful conversation. Thank you so much for sharing your knowledge with us. I really hope that this will help a lot of our listeners who are dealing with, struggling with some of these iron deficiency and insufficiency issues. The awareness is really important. Thanks so much for joining.
Thank you so much for having me. I appreciate it.
Thank you, everybody, for following the education series. I invite you to check out more education videos on our YouTube page, subscribe to our newsletter at naturalfoodpantry.ca, and be sure to follow us on Facebook and Instagram. Stay healthy, everybody.